Hello.
Welcome,
Hi,
everyone.
everyone.
Go ahead, Paolo.
No, I was going to welcome. You take it.
Yeah, come on in, everybody. Welcome. We're just getting started. We're probably about 30 to 45 seconds from kicking off today's webinar with Caregiver Action Network and our friends at Isaac Health and Elbie. If you could put perhaps uh, where you're from in the chat, and if you're comfortable doing so, your role as a caregiver, if you'd like to. And we'll get started in just a few seconds. Thanks, everybody. All righty. Well, we're off to the races. 70 plus folks already coming into the room, so and we're definitely hitting where the acreage is in the US, Texas, Wyoming, Tennessee. That's great. Thanks, guys, for being here. Great state of Maine. All right. Wonderful. Well, please continue to introduce or tell us where you're from in the chat, and if you're comfortable, what your role is as a caregiver. So we're going to go ahead and get started. Today's webinar is about rural caregivers, individuals living in rural parts of the United States. Although, if you are suburban or even urban, I think you will find some use out of this. And so please don't turn off if you are not necessarily in a rural care part of the country. But talking about isolation and how to gain more connection. My name is Marvell Adams Jr. I serve as CEO of Caregiver Action Network, based in Washington, D.C., is where our offices are headquartered. But as you know, we are a national and at times international organization from the reach we have. Seeing someone checking in from Toronto, Canada, we perfectly timed the reach that we have for our webinars, and just thanking everyone so much for joining us today. Caregiver Action Network is a not-for-profit that serves caregivers all over with support, resources, education, just like you'll see today, as well as many other resources that we'll highlight before we end our time together today. But first, we always really think it's so important to get information from caregivers when we're really engaging with them. And that becomes so important because the resources we provide are really practical. They're rubber meets the road. They are put in the hands of caregivers. And we do that by hearing from caregivers very, very regularly. So we have a polling question here that Dakota has just put up. And if you could just take a few seconds to answer, and that'll be rolling for a couple minutes here. But when neuropsychiatric symptoms appear, and those are really, we're talking about the symptoms of Alzheimer's and dementia. So those that you'd be, I'm sure, familiar with at this point, agitation, memory loss, things of that sort. How often are they discussed with your loved one's doctor is our poll question for you. And it looks like there are two questions, Dakota. And so,
Yes. The one is you just scroll down a bit, and the second question would be when these symptoms are discussed with the doctor, who usually brings them up? Me slash the caregiver, the person with dementia, another family member, or not sure slash fairies.
great. Thanks, Dakota.
Mm-hmm.
All right. Well, as you continue to answer that polling question, uh-oh, I'm really fearful that I just clicked my Microsoft update accidentally. I think I'm okay. I just had a small heart attack. Apologies, everybody. Looks like everyone's still there though, so no worries. So let's see. I'll go ahead and introduce our agenda, but Dakota, did you want to say anything about the poll before we move on?
Yeah, sure. I'm gonna end the poll here. And so I'm gonna share the results. And looking, it seems like out of the 52 of you that participated, the most that we saw to the first question, when neuropsychiatric symptoms appear, how often are they discussed with your loved one's doctor? About 40% of you said sometimes. 12% said always, 13% said often, 19% rarely, 4% never, and 12% not sure. With the second question, when these symptoms are discussed with the doctor, who usually brings them up, a large majority of you said me, slash the caregiver. Uh, about one of you said the person with dementia. A few of you said another family member, and 13% of you said not sure slash varies. So, really interesting spread here.
Yeah. Wow. Thanks everyone for participating. That really helps us with our own information gathering, and particularly as we work with medical providers on how to best support caregivers and include them in the conversation and making it a much more impactful in-office and even telehealth visit for individuals. So thanks so much. So let's just go over our agenda for today. So I'm gonna not only just welcome you right now, but we'll also do some introductions in a moment to give everybody insight onto who is participating today. And I apologize, my Microsoft is so absolutely wanting to update everything now. So I'm just having off. We'll do welcomes and introductions, and then we're going to have a bit of a presentation to talk about the types of symptoms and behavior that may exhibit when someone is navigating cognitive change like Alzheimer's disease or dementia, and a panel discussion along with our guest today that I'll introduce in a moment. We'll talk about some key takeaways and just some group reactions on our time together, and then save some time at the end for Q&A, and we will finish up right around 2 o'clock because I'm sure everyone has a lot to do each day, so don't want to be disrespectful of your time. So first, I'd like to introduce our two guests today after I've told you a little bit about myself. But today with us is Dr. Linda Buscemi, who is a clinical psychologist. She's has over 30 years of experience in behavioral health and long-term care. Dr. Buscemi is also the co-founder of Elbie, a digital support platform for caregivers with individuals with dementia. She's known for her empathetic and needs-based approach to behavioral symptoms, but also Dr. Buscemi brings both clinical insight and real-world understanding to help caregivers feeling supported, confident, and less alone. Welcome, Dr. Buscemi. Thanks so much for being here with us. Also, Dr. Joelle Salinas is the Harvard-trained behavioral neurologist and founder of Isaac Health, which is an at-home memory clinic focused on brain health and dementia care. He's an assistant professor of neurology at NYU and has authored 40 plus academic papers. His work on brain health and cognitive function has been featured in the New York Times, Wall Street Journal, and Forbes magazine. Dr. Salinas, thanks so much for joining us. Glad to have you with us. All right. Also, just want to take a quick thank you. Today's webinar and educational session is made possible by the support of Lundbeck and Otsuka. We really appreciate their continuing support as we reach out to caregivers of individuals with dementia or cognitive impairment, and really try to provide support for caregivers and guidance as they navigate their caregiving journey. So thanks to Lundbeck and Otsuka. So, what does NPS mean? It's an important distinction, and it is a terminology that we at Caregiver Action Network have been using more and more often, in order to really describe, which is a real whole a suite of symptoms that go along with the dementia and the Alzheimer's and related dementia. So NPS stands for neuropsychiatric symptoms, and it includes, as I said, a range of behavioral and psychological changes from the stem that stem from the progression of Alzheimer's and related dementias. These symptoms reflect how the condition affects not just the memory, but also really the mood of the individual and the overall brain function. And so, many times what folks show up and are describing, is NPS, those changes that are being seen in their loved one, and the change in mood or behavior that is, sometimes difficult to navigate. And so, throughout this presentation, we may refer to NPS, but just keep in mind that we're referring to really the whole range of behavioral and psychological changes that may be experienced for somebody. So, the other piece of this is, why is this important for caregivers? And that's really important distinction because, there are aspects of this that have to do with caregiving, that have to do with medication, that have to do with doctor's visits, that have to do with transportation, all sorts of things. But, this in particular is an important topic so that really not only you can understand the symptoms that may be exhibited, but also having a conversation with the care team and particularly your provider. So just to give you an overview of what those look like on the next slide there, NPS symptoms, they often interfere with daily routines, and that really is one of the demarcations that comes along with it. All of us at times have memory lapses. We forget where our keys were put and things of that sort. What we're really talking about here are things that interfere with an individual's daily routine, whether it's sleeping, eating, and bathing, and those simple tasks that can really be exhausting for caregivers to be able to support their loved one with. Caregivers may sometimes feel guilt or confusion or even fear when their loved one, acts like someone else, that they aren't the person that they knew previously because of what they're exhibiting in those neuropsychiatric symptoms and really seeming to be a different person from their behavior and making it more difficult to connect. What we find is that, without guidance, some caregivers may interpret NPS as intentional behavior, that it's something that, is being done as a resistance to being cared for, or in some aspect, sometimes family members see it as something that is deep rooted in perhaps a past experience or a relationship dynamic that goes on with the family member that's that's the care recipient or the caregiver. But it could be just quite the opposite, that when we talk about this, it's important to understand that whether it's someone that has symptoms from the flu, from cancer, from heart disease, these are just like with those diseases or illnesses. Neuropsychiatric symptoms are not intentional, and they are not something that the individual is turning on and turning off. Assessing timely professional insight is really important when it comes to NPS and what caregivers have an understanding of. And so that can mean the difference between escalation and prevention of harm for the caregiver or the person living with dementia. And so understanding that these symptoms, having the insight and understanding the symptoms themselves can really arm the caregiver with better knowledge and hopefully keep an interaction from escalating in a way that can be harmful to the caregiver as well as the care recipient. Now, in rural areas in particular, even identifying NPS as a part of Alzheimer's disease, as not a separate illness, mental illness can be confusing due to a lack of awareness or stigma. So, understanding that, and I grew up in a rural part of South Carolina. I think I saw someone checking in from Charleston, where I actually went to school. So, this perception amongst the family that it is a mental illness in the sense of anxiety or depression or bipolar disorder or something along those lines, but that it has a distinction and is not something to be necessarily minimized as being something that is a part of a stigmatized or more stigmatized area of mental health. So, lastly, what we'll talk about before we get a bit more into the conversation, and I bring our guests into the conversation here, is that Caregiving in rural areas is really an interesting aspect in why we wanted to really focus on rural areas today. One, because of the need for more access to resources, but also coupling that with the fortunate aspect that isolation can be even more severe in rural parts of the country. And so, recognizing a few statistics. Rural areas have 20% fewer primary care providers than urban areas. And urban areas are not flush with providers. And so that really is saying a great deal and leaving 65% of rural counties not having even a psychiatrist that they have access to. And so this is a real world right now problem that we're dealing with. And then also recognizing that 81% of rural counties do not have a psychiatric nurse practitioner. And so really having little to no access to a provider of any kind, and a psychiatrist being one of the providers that would provide support when it comes to mental health in the United States. So the geographical remoteness, along with shortages of mental health professionals across the country, really compounded in rural areas. And so it makes it far more difficult, not only for caregivers like yourself to find support for your own needs and mental health support as you perhaps navigate being a caregiver and journeying alongside your loved one, but really just making the isolation that we're going to talk a bit more about today even more pervasive, even more difficult to navigate. Just a quick answer to a chat question that yes, we will be providing the slides. The entire webinar is being recorded, and you'll be able to access that on our website later on. So thanks so much, Jody, for answering that question in the chat as well. Let's see. And we are now on to slide 11. So I just now want to bring in, because this is definitely now no longer my area of expertise, but I want to bring in Dr. Salinas to talk a bit about the symptoms of Alzheimer's and dementia, and just talking a little bit about what that progression can look like, as well as kind of an overview of what the documentation tools and information when a medical professional is engaging with and assessing someone for Alzheimer's and related dementia. So Dr. Salinas, can you join us, and I'll hand it over to you.
Amazing. Thank you so much, Marvell. So lovely to see you all. So yes, I'm Dr. Salinas. I'm a dementia neurologist, as was mentioned before, and Chief Medical Officer, co-founder for Isaac Health. One of the things that I think is just really important to think about with these neuropsychiatric symptoms is that they evolve over time and they vary from person to person and in different situations. So, I wanted to share this one kind of slide here, mostly as a visual to kind of communicate a little bit about what the symptom progression can look like over time, and also just how common and how uncommon some symptoms can be. But I think I also wanted to acknowledge up front that this is really accounting specifically for Alzheimer's disease as a cause of dementia, where someone's dementia kind of cognitive or behavioral changes can be due to other conditions as well, or a mixture of combinations that can be dementia with Lewy bodies, prototypical dementia, vascular dementia. And each of these kind of conditions can look very different, also depending on what parts of the brain are being affected. Because if a particular part of your brain is being affected, then you're going to develop deficits or issues with that part of the brain that's specifically being affected by the disease. So, for example, if the speech part of the brain is being affected, you're more likely to see issues with speech. Whereas if someone has issues in the frontal lobes, which is helping the person to regulate and kind of pay attention to things, you'll get a whole different other set of symptoms. So what you can kind of see from this slide here is kind of from the early to moderate to late stages of the disease, you can have a progression of the different types of symptoms. Neuropsychiatric symptoms can develop in the earliest stages. There's a lot of emerging research showing how anxiety might actually be an early manifestation of these diseases. We used to usually think of memory issues as being the main symptom, and it's true to some degree in the most typical cases, but anxiety, even depression, disinhibition, impulsivity, these are all things that can be early manifestations of disease. They may not be really, really noticeable up front, but you're starting to notice some of these changes. one of the changes that can happen early that relates to a lot of research that I've done in my career is kind of changes in social relationships. So loneliness, for example, is a really interesting symptom in that sometimes we think that loneliness can increase your risk of developing these conditions, but there's some work also suggesting that having some of the brain-related changes due to Alzheimer's disease, as an example, can actually manifest themselves with symptoms of loneliness, perceiving that you're socially isolated. And at the same time, one of these early symptoms can also be social withdrawal, so becoming progressively more socially isolated. That might be due to parts of the brain that are really involved in navigating social relationships being affected, but it can also be due to anxiety. It could also be just due to someone's other symptoms feeling really embarrassing for the person, and so they're just likely to engage in social situations. But as the disease progresses, we start to see more of these really distressing types of neuropsychiatric symptoms. And so things that you can kind of begin to see are things like agitation, agitation being moments where the person can become very dysregulated. It can be very difficult to redirect them. They can have outbursts. They can be reluctant to kind of participate in activities. Sometimes that can get to a place where it can become very violent, or there can be some combativeness. And I think that's something that as a provider myself, it's just very important that we always think about safety, not just for yourself, but also for the patient, the person living with the condition. So if you ever feel like you're in an unsafe situation, do call 911, go to the emergency room. But we always encourage people to engage with their healthcare provider, their specialist earlier on, so we can manage these symptoms early. But other manifestations can include kind of lability or mood swings. So going from kind of very happy to being very depressed. People can become even more impulsive, so saying or doing things that they wouldn't typically say or do. As Marvell had mentioned, kind of their loved one being a different person can kind of come up here where you have pretty big personality changes. You can also see some changes related to judgment, so becoming more susceptible to scams, kind of impulsive buying, or even gambling, or even substance use, like alcohol use and things that someone wouldn't typically do can really start to come up. Then people can also develop hallucinations, particularly visual hallucinations. There are certain conditions that are more prone to develop visual hallucinations, like dementia with Lewy bodies. And then people can develop delusions. Delusions have to do with kind of losing contact with reality to some degree. And so people can have some pretty common delusions around feeling that people are stealing from them. As you can kind of see, as the disease progresses, you're more likely to see more of these paranoid delusions that people are out to get you or out to hurt you. Um, and there's some common delusions that have very specific names to them, but some of these can look like fears of infidelity. So feeling that your partner is cheating on you. Um, there can also be feelings that there's somebody else that looks like you, like a loved one in the home, but it's not quite them, or different versions of themselves. Um, and then as the disease continues to progress, you can also get a lot of like apathy, so a lack of motivation or interest in doing things, and that can be really frustrating for a lot of family members. If you go to the next slide, please. And I think this is where, it can be really helpful to have tools to kind of approach these in a really structured way. So there's this one tool called the Neuropsychiatric Inventory Questionnaire, the NPIQ. This is usually used in clinical settings or research settings. I wouldn't necessarily expect that a caregiver would use this one particular tool, but if you have access to it, it could be a useful way to track things. It really just breaks down many different types of neuropsychiatric symptoms, whether they're there or not, and then how severe they are. And you can kind of do essentially kind of like a check over time to see kind of, are there certain kind of patterns that you're seeing? Are things getting worse? Are they certain medications that were started, certain situations where those symptoms get better? Another tool that can be really useful is called the CMAI, the Cohen-Mansfield Agitation Inventory. This is a tool that's used a lot in clinical trials and also used in hospital settings. Um, but can be used to really just put a number to how severe someone's agitation is, and then to see what kinds of interventions or situations make somebody more prone or kind of less prone to developing agitation. And then I would say at a very kind of basic, kind of low-hanging fruit level, I would say just tracking those changes however you see fit, whether that's a journal or a calendar or using a digital log. You can kind of write down what the symptom is or the situation is. You can give it a rating, even just saying like 0 to 10, 0 being not present, 10 being the worst imaginable. And then giving yourself an opportunity to also take notice of any particular situations that might have triggered something. Is it a particular person, a particular change in environment? Is there a particular time of day? And that can help to give you a better sense of what patterns and things may be going on so that way you can actually help to decrease the chances that'll happen in ways that don't necessarily require medications. And even then, you can take that to your provider and say, hey, we're noticing the agitation happening very specifically in the evenings, like in the case of sundowning, as it's called, or it's very specifically happening just before lunch. And that way they can make recommendations around what particular medications, how the medication lasts within the system, or the timing of those medications. So that way you always navigate this tension that can happen with these medications between kind of getting some management of the neuropsychiatric symptom severity and then over sedation or drowsiness, because we certainly don't want people to feel too blunted or too tired to even participate. So it's always a bit of trial and error. Go to the next slide. Great. So I'll just hand it over to the next panelist, to Dr. Linda
Yeah.
Buscemi.
Yeah, Dr. Shimmy, please, we'll let you take it from here as you share a little bit about how caregivers can process the symptoms that emotionally can really be difficult for caregivers, and how Elbie can help.
Great. Well, thank you. Yeah, it's not surprising that caregivers have these feelings of fear, guilt, confusion. It's unfortunate, but it makes sense, right? You're navigating this disease it's ever changing. So just when you think you have a handle on it, it changes due to the progression of the disease. So our brains search for logic, consistency. We like predictability as humans, so which makes being a dementia caregiver just that much more complex. And as Dr. Salinas was talking about, it's a big umbrella of dementia. I like to think of it as it's about having people who have problems thinking, because there's just so many overarching issues that could be causing the different parts of the brain. So as a dementia caregiver, it's not only your role in the relationship that's changing, but your narrative of what you thought. So having these emotions are just inevitable, and having support is incredibly important. So in this slide, I wanted to capture a few scenarios where you might feel frustrated, anxiety, confusion. So let's talk about late day agitation, which can be very common. Many of us might acknowledge that we're more fresher and have more sharp earlier in the day. And sometimes towards the end of the day, we lose our patience a little bit. It's been a long day. So we're emotionally and mentally tired. But I believe late day agitation, which often is called sundowning, I like to refer to it as late day agitation because it occurs when the person with dementia is not only physically, emotionally, and mentally exhausted, but their brain is compromised. So of course, they become agitated at the end of the day. So my recommendation is to prioritize tasks that require brain and emotional energy earlier in the day, and then design the end of the day with more activities that will trigger your more long-term memories, such as reminiscing, looking at old photos, listening to favorite music, old movies, things that require less cognitive and brain processing. If you can move on to the second slide, please. The second point I wanted to make is how to best support you, your emotional needs with real-time help and solutions. So I believe understanding the history of the person is often the root to understand the reaction. So most people call dementia-related behaviors as behaviors, and in essence, that is somewhat what they are. I like to change the verbiage a little bit, that if you refer to them as a reaction, sometimes someone's not behaving badly, but rather they're reacting to a situation. So they're doing the best that they can to problem solve and avoid something that they don't like that's happening, or to fulfill an unmet need that they can't communicate to you. So when you look at it through the lens of that they're reacting to a situation, you can become then curious on what could be causing that. And then using that personalized information that you know about that loved one or about that person to have a better, successful care interaction. So the process flow to get that understanding is to know the person's background, diagnoses, preferences, routines, anything that you can. And that will help us determine two things: what could be causing the reaction, but then the personalized ways to approach and intervene to prevent or reduce any escalations of that situation. So I'm going to give you a couple examples. We're going to use a care recipient named Nancy. So if Nancy's trying to leave the house unattended, usually around the 2:30 time frame, We know Nancy was a stay-at-home mom. She had 5 kids. She could be thinking that she has to pick the kids up from school. So her internal clock might be pointing her in that direction. So now that we have that information, we understood to even what Dr. Salinas was saying is around that time frame, we're able to look at some patterns. We now can find potential ways of avoiding that from even happening in the first place. The second example I want to give you is if Nancy refuses or resists showering, personal care. Well, we also know Nancy preferred to take showers, not baths. We also know that she liked to take her routine for 70 years was taking the shower at night, the bath at night. She liked to put a shower cap on because one day she'll do her hair and the next day she'll do her body, right? We all have these unique routines. So if the caregiver comes in, whether it's a professional caregiver or a family caregiver, and they have time to clean Nancy up during the day, and they forgot to put her shower cap on as an example, maybe that's why she's resisting. Often, sometimes someone with dementia, they can't tell us what's wrong. And even if they do, it might not be for face value. So we have to be prepared for that as well. Thank you.
Thanks so much. Both Dr. Salinas and Dr. Buscemi, that was absolutely spectacular. I know that, that provides such great insight. And as I think both of you pointed out, with dementia related conditions, there's such uncertainty, that makes it so uniquely difficult for caregivers because the communication lines are become more difficult to navigate, and just the person that you're interacting with, the dynamic of just trying to understand what they're trying to communicate with you. And so, as you can see in the chat here, as we've gone along, our content development manager Jody has been putting various tools from Caregiver Action up as we've gone along. And just want to highlight a few others before we move on to the next part of our conversation. And so the first one, navigating Alzheimer's, effective caregiving approaches for neuropsychiatric symptoms. This in particular really provides not only information that is research-backed guidance for caregivers, but really providing a depth of knowledge that can give you some of the tools that you may find useful in trying to as you navigate this caregiving journey alongside your loved one. This may be information that you've had access through from your provider, but either way, whether it's the refresher for your memory or a new set of information, this tool can really be helpful in not only helping you understanding and navigating Alzheimer's as a caregiver, but also providing you the ability to really understand the symptoms that you're seeing and even track what's going on with your loved one a little bit better. And then the second one is about agitation and a screener that can be utilized that's readily available for anyone. That's the AACS questionnaire, which is Assess, Adjust, Connect, and Support. It's a quick caregiver self-assessment to evaluate symptoms and uncover next steps. And so this really can go hand in hand with our conversation today. And again, many times we feel hopeless as caregivers. And again, when we talk about isolation, that is absolutely a part of it, that feeling as if there is not a avenue to connect with, within your purview or circle. But this is one way that you can take some license back in being able to actually understand and track and see and self-assess what symptoms may be exhibiting. It can make it easier for the conversations that you're having with the provider for the next appointment, but also to give you a sense of what may be happening and when it may be happening, to give a better sense, as Dr. Buscemi was talking about, the cadence of the day and perhaps how to do planning as you engage throughout. The other resource that is available to everyone on this webinar today and anyone in your circle, so feel free to share it widely, is Caregiver Action has a nationwide caregiver help desk. And so the number up on your screen there, 855-227-3640, is a toll-free number that you can reach out to a caregiver advocate that can provide support. And it is a single site of entry for caregivers, meaning it's not caregiver if, caregiver, when. It's really caregiver, period. That if you reach out and need support, either understanding what's going on with the symptomatic changes in your loved one, understanding what Medicare smoothing means for a Medicare Part D plan, or just if you're having trouble yourself and needing some mental health support or other guidance or referrals to providers, we really do endeavor to help individuals and meet them where they are. And so whether that means we refer them to local resources or support groups, or even just connect them directly with information that may be helpful in that moment, you can reach out through the phone. You can actually do a web chat feature if you prefer not to give someone a call. If you go to our website and you can do a web chat, and you can also email and get information that way. So a few different options. So feel free to reach out regularly. And then just want to point out that one of our partners that that comes alongside of us for many of our educational sessions, Mental Health America, has a wonderful rural mental health hub. Caregiver Action, we really make sure not only to share our information, but the best information we can provide out there and curate for you. And so in addition to our friends at Isaac Health and Elbie today, we just wanted to really highlight the Rural Mental Health Hub that is at mhanational.org/rural. And that really provides information on well-being in rural communities, and especially valuable, we've heard for and we've found for caregivers of individuals with Alzheimer's and related dementia. So we'll leave that with you. All righty. And so now we're going to come back around, I think, to Dr. Salinas, just to talk a little bit more about Isaac Health and what that may mean for yourself as a caregiver and your loved one. Dr. Salinas.
Great, thank you. Yes. So at Isaac Health, we've essentially taken the kind of center of excellence model of care for Alzheimer's disease and related disorders, and translated it also can be delivered via telehealth, with a little bit of a hybrid component where people have issues with internet or technology. We send someone to the home to facilitate the visit for you. We are really passionate about meeting people where they're at and providing access, timely access to care. Because if you've tried to access kind of care within a hospital setting or kind of a specialist clinic, you know that the wait times are very long. Those wait times are about a year, and especially in kind of geographically isolated rural areas, those wait times in the next couple of years will look like 5 or even 8 years. It's a big challenge, especially the huge drive. And so we're trying to bring care to you. And so we provide a whole suite of services across the board, from kind of the comprehensive assessment for individuals, but also specifically to manage neuropsychiatric symptoms. We've got a team of specialists. We've got neurologists, geriatricians, neurology nurse practitioners. We've also got a whole behavioral health team, including psychiatrists and psychiatric mental health nurse practitioners. We're all trained in how to talk about these symptoms, how to manage them, figure out what the best medications are, and what things that are not medication related that can be helpful. We also are able to provide access to counseling in the form of talk therapy, but also to provide support for caregivers in the form of counseling and connecting with all the right resources that are available in your area. We're also, and I saw some kind of information about this in the chat as well, we are also a guide model provider. This is kind of the Guiding and Improved Dementia Experience program from Medicare, specifically for traditional Medicare, where people get a comprehensive suite of kind of evaluations, follow-up with a care navigator, 24/7 support, even access to some respite services. Isaac is able to provide that. And even if you don't qualify for the guide model, Isaac Health, we've got a whole system so that when you can get access to all of this great care navigation, coordination, and support services that would be most helpful for you, especially when you need it. And I know a lot of people really, really appreciate getting that 24/7 support and the ability to schedule an appointment with somebody within just a few days to be able to make adjustments to medications or even just ask a question.
Great. Thank Dr. Salinas, and just really appreciative of the continued partnership, because this is just, as I'm sure everyone on this webinar understands, such a critical issue with access to providers. And so just appreciating Isaac Health being there. And in that same vein, Dr. Washimi, if you could tell us a little bit more about Elbie, because more and more we need access to information 24/7, because it's not a 9 to 5 when it comes to caregiving by any stretch of the imagination.
Yeah, it certainly isn't. And I love what Isaac Health is doing, and it's needed, and it continues to be needed. My mother-in-law lives in a very small town in East Texas and has mild dementia at this point. And the resources for our family are limited, and we can wait days to be able to get an appointment, whether it's for my brother-in-law who's really caring for her or for her herself. So I wanted to build a tool, which is Elbie, to make it be as accessible as possible for that caregiver 24/7. You can just pick Elbie up. It's a digital application, and ask Elbie anything. It will help you to figure out why the reaction is recurring, because it stores everything that you're telling it, so that way it can create those patterns to understand. And just like I gave you suggestions, Elbie will actively communicate with you. So it's like having that clinical knowledge and behavioral expertise right on demand, helping you to get to that answer when you're noticing your person having a bad day. Can help you develop some activities that help you throughout the day to be able to hopefully prevent that late day agitation and sundowning. And even support your own personal stress. You know, I'm frustrated today. Just like Elbie would ask you questions around that. Let me see if I can help you through that, because the more that we can gain awareness on what's happening, the better we're able to help you or your loved one. So we really complement your medical care team, like Isaac Health, with a 24/7 convenient and quick way to access support.
Great. Thanks so much. All right. So just you know, want to take a moment to just have the panel part of our discussion today, and just pose a couple questions to y'all. And I'll start with you, Dr. Salinas. So, you know, if you could provide one piece of advice, you know, to rural or isolated caregivers that are feeling overwhelmed by their loved ones' neuropsychiatric symptoms, you know, what would that piece of advice be?
Yeah, I think, and this is similar to kind of what Dr. Bashimi had mentioned before, is just taking a moment to empower yourself with what options you have in managing these symptoms. I think when people feel really overwhelmed or disempowered, it usually comes from lacking a feeling of control or understanding of what you can do about the situation. And so sometimes that involves doing research, attending webinars like this one to learn more about it. But that can help to also give you ways to think about kind of what these symptoms mean. Is it something that can be broken down into kind of small wins? If you're able to learn a new pattern or a new kind of intervention, or figuring out, oh, this is a particular time of day, things get really, really tricky. And I think it has to do with kind of the temperature or the amount of noise that happens. And just being able to make some of those small changes, and knowing that this is not a one-day thing. It's a marathon, and it takes a bit of time. And so finding that support network to help you kind of be compassionate with yourself, and knowing that we can't make these things just better in an instant, and it'll take a little bit of trial and error to make it happen. And make sure that you're enlisting kind of the support of the people in your network, whether that's your medical team, your family, your friends, resources like the Caregiver Action Network, and other tools kind of like from Elbie that could help to kind of boost up your team that you have to support you.
Yeah, really well put. Yeah, we underscore it as much as we possibly can that, being able to reach out to where you can find support, and part of this session day is related to the fact that many times people don't have access to that network, and so being able to find those ways, whether it's through digital connection, through companies like Isaac or Elbie, through resources at caregiveraction.org, .org, and really being able to understand that there are options out there for you. Dr. Bashimi, I'll turn to you next and ask, what do you wish for caregivers to understand better about neuropsychiatric symptoms and how to respond with them to them with confidence and with compassion?
Yeah, some might think these behaviors are intentional. And sometimes because we're looking at the logical way of trying to navigate this situation with a known relationship with someone. We know the history, we know their personality, we all have unique personalities. And so we think that these can be intentional in what's happening. And that's where I always go back to, it's really about a reaction. And I think why it's such a complex situation is exactly what Dr. Salinas was saying. Depending on what part of the brain is being affected, the reaction is going to come out a different way. And so the more we're curious and try to understand what could be causing that, you're going to be, you're going to have an advantage on that, right? We can't change something we're not aware of. So the more that we can understand ourselves, and how we're reacting to that person, and how we can calm ourselves before understanding that they're doing the best that they can. And let me figure out how I can help that. And that's why LB was built. It's so complex and so difficult. After 30 years, there are times I get stumped still. So the more that we can have all the supports that have been mentioned today, it's incredible. And it's not a one and done. I think it's multiple. And so I think that understanding that reactions are rooted from the person searching to how to solve their problem.
Yeah, yeah, really well put. I mean, the humanity is always there in the caregiver and the individual that's being supported, and being able to navigate and tap into that can be challenging, but it also, can be a part of the solution, and understanding that, your loved one is still there and they're trying to communicate with you as best they can. And the unfortunate part that I think, caregivers come to the understanding that, if something's going to change in the sense of this approach or the interaction, it's most likely going to need to be the caregiver, and being able to understand that, giving yourself license to embrace that, and also the grace to understand, like, nobody, just like you said, in 30 years, Dr. Shimi, you don't always get it right, and no one can or will or should expect themselves to. If you have a perfectionist mentality, please understand this is the one thing you will not perfect. You will strive for, and you will learn many things, and that's the reason for our session today. So, I'll pose this to both of you, but, we've talked a lot about, support options, from clinical care to emotional supports, to digital tools. What is one practical step that a caregiver could take, right now, this week, to lighten their burden? What would you advise? What would you share? And I'll start with Dr. Salinas.
Sure, yeah. I think one thing that I sometimes think about is, we often hear about kind of the need for respite, right? To take a break, to have some relief, and that's really, really important. I think we can sometimes run into situations where it's really challenging to be able to afford formal respite care or to get access to it, especially when you really need it. And, one thing that I learned that I really like is just the idea of micro respite. So, kind of really paying attention to those opportunities where even if you just have like a minute to yourself, really being aware that this is 1 minute is my respite for right now for this 1 minute, and it can look different for each person, and it can happen. You can have some days where you have lots of moments for micro respite, and some where you don't have much. But even thinking about like when you're able to take a shower by yourself, that time that you're taking to take a shower, that could be a moment of micro respite. And I think just becoming more aware of those times where you're able to take a little bit of a break for yourself and finding ways that you can make those happen a little bit more often can help to start to lighten the load, even if it's just a little bit.
Yeah, great. Thank you so much. Dr. Shimi, what do you think? What would you say, one practical step for a caregiver to take this week to lighten the load?
I'm going to stay in the same vein because I think it's super important is to have a plan. And it sounds a little cliche, but when you have a plan, because when you're in the moment of chaos and then all of a sudden you have that moment, then you're like, okay, what do I do with this 5 minutes? If you have a plan, it could help you. So first of all, starting off with these great resources that were mentioned today, build your account, have an intake form with Dr. Isaac or with Isaac Health. That's a great start, but also have ideas on what you can do for those moments. have a brick prepared, know someone that you're going to call. I'm going to call this particular friend, or just sit outside, watch social media clips of your favorite comedians or animal reels, right? Caregiving can be incredibly rewarding, but can also be very difficult. And so we always say is the caregiver is the intervention. And so having full awareness of your own emotions and where they're coming from, and continuing to have that detective mindset for your loved one can just be a game changer. So again, kind of have that plan, understanding your resources, and those moments when you do have a moment, have some ideas on what you can do to satisfy those few free moments for your own mental health.
Yeah. Wow, that's great. Yeah, thank you so much, both of you, for focusing on that self-care aspect of it, because, it's a piece that we underscore constantly at Caregiver Action Network. And when people come to us, usually, they are asking for support for themselves in order to be able to support their loved one, but many times not recognizing, that tried and true advice of putting on your mask, as they say in the airplane, the part no one listens to, before you put on someone beside you, and helping them with their oxygen mask, putting on your own, because that is really the only way you're going to be able to continue to show up for your loved one, and taking that time. One of the things that I'll point out is for the content on caregiveraction.org. We've spent a fair amount of time over the last couple of years or so really trying to make it accessible in small digestible chunks. So like today's webinar is recorded and will be uploaded to our website. And if a friend of yours has 5 minutes to look at a section, or 10 minutes here and to pause and come back, they can do that. Or some of our micro learning sessions where they can go in and track how their progress is going without having to sit for an entire 15 or 30 minutes, but just 5 minutes at a time. And just as mentioned, just having that plan and that opportunity. So really just appreciative of everyone's time. So as everyone has seen, just a bit of housekeeping before we move into the Q&A part today is Nicole mentioned about, as a token of appreciation, we're doing a raffle for a gift card for the names of folks that completed the additional questions as a part of registration. So we will reach out to that winner after today's session. But now, if we could, we will switch over, and I know Nicole and Jody have been monitoring our chat really well, and can point out some questions for us. Carissa, thank you so much, that came up already is, can SSRIs cause manic symptoms? Now, I know that is a very broad question, and so not knowing all the details of it, but just in general, is there any feedback either of you could provide, or advice you could give that the individual could talk to their provider about?
Yeah, I'm happy to chime in here. So, an SSRI is a selective serotonin reuptake inhibitor. It's a medication that's typically used to help to manage symptoms of depression or anxiety, but can also help with some other symptoms. It just helps to kind of level some of the activity in the brain. And I think there can be side effects with these medications, just like any of the medications that affect the brain broadly. And so it's something to always keep in mind when you're talking with your provider about different medication options, always asking about what the potential side effects might be. And then when you do start the medications, really paying attention to any new symptoms or any new changes that can happen. So yes, SSRIs can sometimes cause manic symptoms. It can also cause kind of a whole suite of other kind of symptoms that you want to keep an eye out for. Same thing with antipsychotic medications. We don't like to use them readily within these conditions, but it has its own suite of other kind of potential symptoms that come up. So it's something to keep an eye out for. I think one of the things that we also want to keep an eye out for is if someone's on too many medications that increase levels of serotonin in the brain, that can also lead to complications. And so we want to make sure that things like abnormal heart rhythm or kind of motor changes, it becoming more rigid or developing like fevers and things like that as a side effect, that you flag that for your medical provider as soon as it comes up, so that way they can help to address and probably help to manage the situation before it leads into a crisis that needs to be presented at the hospital.
Thanks so much. Great. Nicole or Jody, what other questions?
Yeah, we had one question come in through the Q&A portion here, and they were asking, they are caring for their mother, who is quite combative and violent when others are trying to assist her with some day-to-day care. And redirecting and that kind of thing doesn't necessarily help. And she screams quite a bit. The caregiver said it's exhausting and the medication has not helped. Do you have any suggestions for what we can do as a family to help her and to provide some relief for us to feel less battered?
Yeah, I'm happy to take the first crack at this. I mean, I think that there's some questions to be asked, and that's where this is the curiosity mindset of what diagnoses does she have? I'll tell you a scenario that we had. And this is a true story. We had someone who was combative. When you say with what, it was oftentimes not so much transferring or not so much taking medication, but it was always taking off her clothes, like changing her clothes. And after deductive reasoning and trying to figure out what is causing that, it was, well, I would ask the question, does she resist when you're taking her shoes off? No. Her pants? No. Her socks? No. Her top? Yes. When we look at the history of that, she fell off of a horse when she was 13, broke her clavicle. That was nowhere in the diagnosis sheet, but we talked to the family to get the history. And so the intervention, again, you are the intervention. When you lifted up her, right, she started hitting you. She was telling you to stop. But we saw it as, well, she's bad, she's behaving badly. No, she's not. She's telling you, you're hurting me. So what I always say, anything like that, is please assess for pain, uncomfortableness. They might have to use the restroom and they're trying to tell you that. They might be cold. They might be modest, forgetting who you are. Let them know who you are. Remind them of who you are. Cover them as much as you can. Even when you're changing them, give them a towel, especially if they're hitting. If you give them something to hold on to and say, cover yourself, help me, now their hands are occupied. And then you can try to care for them. So there's a lot of ideas, but that would just be the start there.
Great. Thank you so much.
Yeah.
Yeah, and I can build off of that real quickly on the point about medication. I think once if you've exhausted kind of the non-drug interventions, if you've tried a medication, it doesn't work, that doesn't mean that the medications don't necessarily don't work at all. It just might mean you haven't found the right medication or the right dose. And that's something you would work with your provider to figure out. There's a whole lot of these medications. They all come with their own side effects and levels of effectiveness. And so I would say it's something to bring back to the provider and say, we've tried this one and this one and this dose. What else is there? Should we change the time that we administer it? Should we increase the dose? Should we try something else? Because oftentimes you're able to find a medication that works, but there are some really tough situations where there's lots of side effects. But I would say usually there's at least one or two options at the right dose that helps to kind of really make some headway.
Great. Thanks so much.
We do have a couple more questions that have come through. And this is a big one. And there may not be a simple answer to it, but how will Medicaid cuts impact supports for MPS? So some of the things that we've talked through today, what can a caregiver anticipate with some of those cuts making access to that more difficult?
Mm.
I'm happy to maybe briefly address that. I'd say, yes, with Medicaid cuts, certainly that will impair access. I think the one thing to think about is what are the other options beyond what Medicaid benefits are available. So working with a social worker or working with your medical provider's office to see kind of if you're able to get on Medicare, that's a big option. So there's like the guide program that I mentioned that provides all those services at no cost to the patient. And then seeing if there's other ways to kind of like local community-based resources that can help to provide some of those supports outside of what would be typically provided under a Medicaid plan.
Yeah, I would couple that. I totally agree. I think that if you can find supports in your churches, your local community centers, but even family and friends, and it doesn't, and obviously this wouldn't be around treatment, this would be about support for the caregiver, but it would also help to when you have a group of people that can help, it can be the simplest things of who can pick up the medication, who can help mow the lawn. There's a lot of things that help that you have to care for. And so when you can build a community around you to do some of those things that are not based on needing Medicare or a payment, that would be something that I might encourage someone to do.
Thank you.
Great.
We do have a couple more questions, but I know that we're at time. What I'll do is make sure that members of the panel get these questions and we can respond by email.
Great. Thank you so much, Nicole. Just a huge thanks to our guest panelists and speakers today, Dr. Buscemi, Dr. Salinas. Thank you so much for taking the time. I know this is a very complex set of symptoms that go along with Alzheimer's and related dementias, and no one case is exactly the same. But we appreciate you guys taking the time to really provide some guidance and insight for us, and really appreciate again our sponsors, Lundbeck and Otsuka, for continuing to support our work at Caregiver Action as we educate caregivers in this area. And then lastly, as we click to this last slide here, we'll give you, all the information perhaps to reach out to Caregiver Action Network, or actually maybe this is the last slide. Dakota, I don't know if there's one after this that shows how they can reach out to us. Oh, there it is. Okay. If you want to reach out to us through a phone or email or our website, or even across social media, there are many ways that you can perhaps stay connected as a caregiver. We have a really great Facebook group community that Nicole heads up that has grown to the thousands over the last year or so, really kind of underscoring caregivers looking for connection. And so we invite you to participate and be a part of that, as well as the other platforms as you see up on the screen there. So thanks again to everybody for participating and for joining us today, and enjoy the rest of your weekend. Have a great holiday weekend if you are having the space to have this as a holiday weekend, or at the very least, maybe make a commitment to 10 minutes at least to yourself during this 3-day weekend. So thanks so much, everybody, for taking the time, and we'll see you again soon. Yeah.